Hello, my name is Michael Lichtenberg from Arnsberg Vascular Centre. I'm an interventional angiologist. Today, I would like to present you the first report of the 12 months data from the SUCCESS PTA study. So the SUCCESS study aims to analyze the efficacy and safety of the sirolimus drug-eluting balloon technology, the SELUTION technology, in patients with above the knee and below the knee in 723 patients. This is an all-comers registry where 27 sites worldwide included patients into this trial. So in this all-comers registry, we included 723 patients. These patients suffered from peripheral artery disease above the knee and below the knee. We included patients with claudicant symptoms as well as critical limb ischemia patients. So we tried to analyze the efficacy and safety of the SELUTION drug-eluting balloon technology in an all-comers registry way. So the primary endpoint of this study, as mentioned, was to analyze the efficacy and safety. For the efficacy endpoint, we defined the clinical driven target lesion revascularization, CDTLR, at 12 months as the primary endpoint. Of course, secondary endpoints including success of the device as well as death, target lesion revascularization, and target vessel revascularization was included. In terms of the primary efficacy endpoint, clinical driven target lesion revascularization, we were very happy to see a freedom from CDTLR at 365 days for the full cohort of 91.1%. For the subgroup claudicant, 91.3% in terms of this endpoint, and for the CLTI subgroup, 90.3%. Having said this, these outcome efficacy data, especially for patients with critical limb ischemia, were very positive to see, and we were actually surprised to see so good outcome data, especially for patients with critical limb ischemia. So these findings in terms of all-comers patients, so patients we see in our daily routine, shows that this technology seems to be a breakthrough technology for the treatment patient with above the knee and below the knee. Further subgroup analysis will definitely help us to give us more insights which patient might benefit from a SELUTION drug-coated balloon angioplasty in conjunction with stents, for example, or with a dedicated lesion preparation, including atherectomy and scoring devices. So we will perform some subgroup analysis in the future, but I think the outcome of this trial with the 12 months outcome in terms of freedom from CDTLR, I think is something we should take in consideration to use in our patients as a daily routine. As said, 91.1% freedom from CDTLR for the full cohort is quite convincing. So as briefly mentioned, we will now perform, of course, subgroup analysis and dive much deeper into the data and define more subgroups, especially in terms of BTK versus above the knee revascularization, for example. We also will analyze the efficacy outcome in conjunction with stent implantation. Of course, we will follow up these patients further on. The endpoint is after 5 years. So we will analyze the patient, of course, also for safety endpoints during these 5 years. So we hopefully will see also very positive data within the next years.